My name is Karol Hoang, and today I'm going to be presenting to you my disease, Eastern Equine Encephalitis, or what I will be referring to as triple E. The formal name of this disease is Eastern Equine Encephalitis virus, or EEEB. So the common name of it is triple E, as I already mentioned, or sleeping sickness. So moving on to infectious agent and taxonomy. So the infectious agent of this is that causes triple E is the alpha virus. And onto the right here, you can see my cursor. It's the family name is the Toga verde. The genus is the alpha virus, and the species is the alpha virus Easter. Moving on to the characteristics here. Characteristics of triple E. It's single-stranded RNA. Its shape is spherical, and the size of it, or the diameter, is 60 to 65 nanometers. Now on to the strands. So there's 4 distinct strands of triple E. So the first one that applies to triple E is group 1. Group 1 is consistent only of triple E viruses and is an endemic in North America and in the Caribbean. However, so the other 3 strands, 2A, 2B, and 3, are all related to the Mataranga virus, formerly known as the South American Eastern Equine Encephalitis virus, caused primarily on horse illness in Central and South America. So when I'm referring to equine, this word, you highlight that, equine, I'm referring to the horses. Now, moving on to the pathogenesis. So the pathogenesis. Triple E is a vector-borne transmission with the Culiceta melanura mosquito serving as the primary vector. Now, the transmission to human and horse occurs via bridge vectors that are feeding on infected birds found in forested wetlands. So here to my right, the diagram shows that this mosquito is a bridge vector because it's feeding on this infected bird, and then it's going to bite on either its end host, a horse or a human. And now what does it do from there? From there, it replicates the virus in the lymph nodes. It starts at the lymph nodes. The central nervous system then is invaded and through the blood-brain barrier causing neural infection. And then from there in brain, there's neuroinflammation causing neural damage and brain swelling. And after that, the virus triple E finds its home within the brain and invades the immune response. It just continues to infect the body. And from there, encephalitis occurs if within the brain inflammation, and then causes onset, death, or severe neurological impairment. Now, what are the symptoms of triple E? Triple E symptoms that are commonly seen are you get chills, you get some joint pain, and then you get a fever or muscle pain. And these are the hallmarks of triple E. And especially if you have neck pain, stiffness in your neck or rigidity in your neck, then you're just going to have like a good chance with that, of course, a mosquito bite. A good chance you have triple E. Now moving on to past the symptoms. So the symptoms you experience those like after 1 or 2 weeks, 1 or 2 weeks after that first bite, and then the body just gets they're fighting, trying to fight this disease. But then we get to the long-term effects, or the things that I hope no one that gets triple E experiences, which can be life-threatening and cause permanent brain damage. So these complications of triple E can include behavioral changes, issues with your brain develops or functions, intellectual impairment, your seizures or paralysis, or you can even be in a coma. Now moving on to our outbreaks in ages and gender. Here in this table, I've from 2003 to 2023, we have ages from 18 to 70. So if you're less than 18, then you have a high chance of experiencing triple E because, well, you're not that mature and your body hasn't fully developed into the capability of defending against any infectious agent, so they have a higher chance. And then once we get to 18, we're okay. We're going to do fine. Then we hit 50. Well, that is when we are 50-year-olds. I'm not 50, but I will be. Hopefully I get to that age. But anyway, when you're 50, that's when you're back to being immunocompromised. Your body is not as strong. It's not as fit as we used to be. And then you're just going to be more susceptible to getting triple E infections. And I looked up how many cases per year in the US we experience, and I saw that an average of 11 human cases of triple E are reported in the US annually. That's kind of a lot, but I don't really hear that in Texas. Hopefully it stays that way. Anyway, timeline of cases from 2003 to 2023. 2023. Quickly change that. So here we have a table from 2003 to 2023. And from 2003, there's 15 cases, kind of a lot. And then 04, it's fine. But then 05, my year, go 05. Hopefully, I wish, I'm glad I was born, but maybe not during this time. But anyway, so in the cases, we're chilling. It goes 8 to 4 to 10, and then we get 15 back up. So like back when in 2023. Then it goes back down. We're just chilling. But then in 2019, out of nowhere, 38 cases arise. And these 38 cases happened in Florida and in Michigan. And I'll tell you why in those areas, they're more at risk than people, let's say, here in Dallas. So then we went back down, back in 2020. I wonder why. And then keeps going, drops and drops. Now, incidence and prevalence. So the CDC reported 5 cases of triple E in the United States in 2021. And in 2019, highest cases like ever. So since like 50 years, since 1933, when it was first discovered, when triple E was first discovered, that it had 38 cases. So 19 of them came from Florida, and the other, like, I don't know math, but the other cases came from Michigan up here. And as we can see, well, when I looked this up, it was kind of concerning that as of December 3rd, 2024, there are 19 cases reported within the states, within this table. So like Maine, New York, Wisconsin, and North Carolina. So basically the Northeast, they're experiencing these outbreaks of triple E than in other parts of the US. Now, who's at risk and the risk factors? So as I mentioned before, the adolescent. So Uh, children younger than 15 are more likely to be at risk of triple E because they haven't matured yet. They're not as strong, they're not as fit as those who are 18 and above. And then when we hit 50, we're back down to like when we were young. When we were younger than 18, we are back to being immunocompromised. We're just not as fit, we're not as strong as we used to be to defend off these viral infections. And so, uh, places that are at risk, these risk factors are though people living or working near areas where mosquitoes live and breed. So these wetlands, these swamps, or wooded areas. So like in Florida and in Michigan. So I was trying to explain that. In Michigan, because they're near the Great Lakes, they're more likely to be exposed to these mosquitoes because they have this humidity and like places, bodies of water that the mosquitoes love to live in. And so, another people who are at risk are spending lots of time outdoors, especially at dawn or dusk, when mosquitoes are most active. That I didn't know, and I'm glad now that I know, because I ain't gonna go out at dawn or dusk when I'm camping or when I'm going out. No way. No. Is triple E, are we able to diagnose it? Well, in short, no, we can't. Well, sorry, let me hold back. We can, but it's really hard to. So if you're going to see if you have AAA, get tested, well, you would just go to your healthcare provider, and from there you're going to ask them like, I've been experiencing like the chills, the muscle pains, the aches that for like a few weeks now, and I had this mosquito bite, and I was wondering, what is it? What do I have? And then from there, the provider can do tests such as like blood tests to narrow it down because they're similar tests. Like I mentioned before, it's like almost like the flu. So symptoms like chills, high fever, muscle pain, vomiting, diarrhea, those all sound like the flu. But what could help us is experiencing the triple spinal fluid, a test. And from there, your provider can test if there's any antibodies. Moving on. Uh, is triple E preventable? Is it treatable? Well, the answer is it's not treatable yet because there is no vaccines for triple E in humans, but there are for horses. So, yay, horses, they get to live. We're at risk. But is it preventable? Yes, for humans. So, that annoying bug spray, that mosquito repellent that your mom just goes up and down all over your body? Well, you should thank them. Well, because the mosquito repellent is a pretty good way to repel all these mosquitoes from trying to get to you. And also, another thing is, if you're wearing long sleeves or long pants, that's going to be a good way to like hold back and eat the mosquitoes at bay and like stop trouble. You're not going to get to me today. But maybe when I, wake up at dawn or dusk and I'll just be out. So, what is the research and future outlook of Triple E? So, it's looking bright. There's hope for Triple E. So, I saw that on this Canadian site, integrating peptide synthesis with genomic and uh, protein, proteomic approaches. So, what does that even mean? So, those are the advances in triple E virus research, and from there, the peptide synthesis and all these research tells us that we can now identify the viral epitopes and analyze the protein expression profiles on the virus, guiding the design of more effective peptides for research and therapeutic applications. And in developing a vaccine, ultimately, that's the goal, to develop the vaccine and therapies so that we can prevent this spread of triple E and eradicate it. So with the ongoing research into the triple E virus, these advancements in peptide synthesis, these are essential in developing novel vaccines and therapies. And with the collaboration of virologists, chemists, and immunologists will be crucial in enhancing public health. And if I haven't mentioned it before, I forgot to say that once again, triple E is no joke. Triple E is rare, but it is fatal. And if you get it, 1 in 3 people survive, but then you only get 10 days to live. And then if you even survive after those 10 days, well, you're going to have those neurological, like long-term effects that I've mentioned before. So stay away, use that bug spray propellant. All right, and before I was rudely cut out by ScreenPal, I was going to say, here are my references, and I wanted to say, make sure to leave a like, subscribe, and hit that notification icon until my next video. Thank you so much for listening. Have a great day. Thank you.